Hello. Are you guys tired of me yet? I got one answer. That tells me a lot. We are super excited for our next lightning talk, which is actually a conversation. There's a fatal disconnect in global development policy for young people. Addressing the biggest issues adolescents face, such as mental health, HIV/AIDS, and even road traffic injury, is key to delivering universal health care and the SDGs for all. So here to talk to us about the missing link in UHC and the SDGs so that we truly leave no one behind, please welcome Global Ambassador at Child Health Initiative, Zuleika Mandela, and Deputy Director of FIA Foundation, Avi Silverman. And they'll be in conversation together for us. I love this dramatic emphasis. As you like.
Thank you very much.
You're welcome.
Good afternoon, everybody.
Hi.
Thank you to the SDG Action Zone for having us here this afternoon. We're delighted to be taking part in this very important opportunity, really, to focus in on the SDGs. As we were introduced, I'm Avi Silverman from the FIA Foundation, and this?
I am Zuleika Mandela, the Ambassador for the Child Health Initiative.
Okay, good afternoon. I'm going to start off by, I'm just going to ask Zuleika quite a few questions to really drill into a bit of the work that we've been doing on the SDGs that Zuleika has been leading globally. I want to start off by looking at really focusing on some of your campaigning for the SDGs. Yeah. And you've been campaigning on issues, as we just heard, like road traffic injury and adolescents in particular. And I want you to tell us a little bit about where you've come from on all of this. I think today in the SDG Action Zone, they've been hearing about from a lot of people that have been heavily involved in the SDGs. And I think you have a very strong personal story and personal motivation for getting engaged in all of this. And I just want you to give us a flavor, really, of your personal motivation for focusing on the areas of the SDGs that you do.
Thank you, Avi. My daughter, Zanani Mandela, was killed by a drunk driver in 2010, shortly after her 13th birthday. And that tragedy in my life, in many ways, really led to a burning desire to want to effect some kind of change. I really felt something needed to change because the reality of the world that we're living in is that when my daughter, died that fateful morning, many more children also lost their lives as a result of road traffic injury. And I think people don't realize that road traffic injury is one of the biggest killers of our young people. That together with, so many other, issues that they're burdened with, issues such as mental health, issues of sexual and reproductive health, and again, road traffic injury, as well as non-communicable diseases. And really, as a mother of 5, I wanted to ensure that our children, no matter where they lived in this world, remain protected and remain children and are able to flourish. Because the reality, again, is that not many children get to go back home, like my daughter. So I have been able to, in some way, find meaning in my tragedy. And I think that also had a lot to do with something my grandfather said to me shortly after my daughter passed away, the late Nelson Rolihlahla Mandela. And what he said to me was, darling, you are not the only person to have lost a child. I've lost a child too, and many women have lost children. But for you, it's so that you can bring hope to many women. And, those words have really resonated with me so much, and I think are the driving force behind the work that I do. And so I've always wanted to use my life to effect change in that sense and to, speak hope to the hopeless. Be a mouthpiece for those who are forgotten, and that's our children.
I mean, you talk about your personal experience in all of this, and obviously you come from such a great family. I mean, don't need to remind everybody about the Mandela family and what they've brought to human rights and sustainable development. And you've always taken a very personal approach to all of this. I wonder if you can just tell us a little bit. You've written a book as well. Tell us a little bit about your own personal experience growing up. I mean, obviously now you're focusing on adolescents and youth within the context of the SDGs, and obviously you've kind of been through a lot of experiences yourself, and you're kind of bringing this to your work that you're doing at the moment.
And I stress this quite a lot, is that, I have experienced many tragedies in my life, but these are the realities of so many of our young people. I think about, the times that I've grown up. I mean, I was born into a political family that never really sheltered my childhood in any way. And so I can relate to, these issues that our young people are faced with as a survivor of sexual and physical abuse, as a survivor of depression and self-harm, and as a survivor of someone is in recovery for, addiction, drug addiction and alcoholism. These are the realities of our youth, and I think, governments and international, community need to pay attention to these serious issues that are affecting our young people. And I'm not only speaking as someone who has personally experienced these hardships that our children are faced with on a daily basis, but as a mother who's very concerned about, the future of her own children. I have a 22-year-old daughter, I have a 16-year-old son, I have a 8-year-old son, I have a 5-year-old daughter and a 7-month-old daughter, and, I wonder what this means for their future. Because we're living in a world where our children are subjected to living in fear because they're not protected, and because the powers that be continue to ignore their cries. And so it's very important for me to continuously use my story to bring about, the need and the urgency for us to properly address, these very major health burdens that our youth are faced with.
And you're kind of, I mean, as you say, you're a mother, and I think one of the things that is perhaps vital, really, for the SDGs as a whole is that we've got this kind of very high-level policy framework, which obviously at the FIA Foundation we look at data, and we look at the research, and we put partnerships together. We work with other big international agencies, and all of that is very important, but it kind of doesn't really mean all that much to people on the ground a lot of the time. I mean, it's absolutely vital, the work we do, but it's kind of, what you're doing is you're bringing a very human perspective for this. You're kind of speaking for families, for mothers, for young people in Africa in particular, in your continent. Can you tell us a bit about that? I mean, are we missing something here with the SDGs? Are we missing something in global development in terms of people?
Absolutely. I think the actual human impact, I think is what's taken for granted. And I also think, women like me, mothers need to come together, to fight for, the future of our children and our families. Obviously, the international community and the governments can do much more to effect a positive change in the lives of our children. The SDGs, they focus on protecting children from all forms of violence. Yet our roads, and especially in my region, in countries like Africa, our roads remain symbolic of human trafficking. You have, for instance, billions that are being spent, for instance, in the UN strategy, where they focus on the priorities of child health, and that's an amazing thing. However, I think we're lacking, the main issue is actually to just ensure that, when it comes to children who turn 10 and over the age of 10, that their needs and their rights are also protected. You can't be spending billions of dollars on that, and then just 2% of that global funding is dedicated to, issues that our children are faced with, their well-being and their health. So something honestly needs to change.
Yeah, it's an interesting point. I think that we're what you've been doing in your campaign is focusing on kind of a missing link here, you know, and it's quite an obvious missing link in terms of our youth and adolescents in particular. And, you know, if we're going to deliver the Sustainable Development Goals, this is one group that we really cannot afford to ignore. I mean, in the sort of policy jargon, they kind of talk about this triple dividend, which basically means, you know, improving the health and well-being and life chances of our young people for themselves, but also through their life course, and then for future generations, for delivering the SDGs. And yeah, I mean, can you reflect on that a bit? I mean, we need to engage on this issue. We need to get our governments and the international community delivering on adolescence, as you say. I mean, it's vital, isn't it?
I mean, as an ambassador for the Child Health Initiative, and with the work that we do, I mean, you know, fighting for the rights and the needs for children by highlighting how, you know, they're severely impacted by unsafe roads and, you know, issues like toxic air, because these are real things. But I think, you know, with our global partners, we've shown that you can actually ensure that we safeguard our children's lives. And what we do at the Child Health Initiative is promote safe and healthy journeys to school. So we've shown that it can be done, and I think our leaders really need to pay attention to the fact that the solutions are there, and they need to implement these solutions. And so part of the reason why I'm here in New York is to call for action for our young people, and obviously keeping in mind that I'm a mother with children that I'm worried about, and the children who are still rendered voiceless, you know, especially in developing countries. But I'm here for a call for action for our adolescents, and, you know, to say that we are in desperate need of a global summit for adolescents that is going to properly address the issues that our youth are faced with, issues, again, such as mental health, such as sexual and reproductive health, violence, abuse, you know, because there's no reason that our children should not be able to thrive, you know, and to live and to have meaningful and productive lives.
Very briefly, I'm just before we wrap up, I'm going to just get you to drill into this very, very quickly. I know it's a big issue on road traffic injury. I mean, it's something that is neglected, particularly for our young people. And what we're seeing with global development, as it is that, you know, things are being done that just are not around people. Can you give us a little flavour of that? I know you've been working in some countries, looking at journeys to school and all of that. Give us a very quick, I know in about a minute, and then we'll get back onto the summit.
Yes, absolutely. So just going back to what I said about the fact that we've actually, you know, worked on projects that have actually safeguarded the safety of our children. We recently did a project in Botswana, where with our partners IRAP and Amend, we were able to actually, have road infrastructure that has allowed children to travel to school in a healthy and in a safe environment. So we've actually, you know, saved lives. And I think it's important for us to remember that our children are a priority, and that governments and as well as you know, the international community need to realize that, you know, this is our future that we're talking about. You know, the future of our children and the next generation to come.
And obviously, this is part of what a summit would deliver. We're looking for action here, aren't we? We're looking for financing, increased levels of financing, increased levels of political commitment, and action on the ground. And one of those things is safe and healthy journeys to school for young people.
Absolutely.
And give us a sense of what we're aiming for with this global summit.
So with this global summit for adolescents, it's going to bring in the necessary funding. It's going to bring in the necessary political commitment and the action that we need to safeguard our children's lives.
And just finally, to wrap it all up in terms of the Sustainable Development Goals themselves, how would you characterize it? I mean, what are we looking at here if we don't do it for the Sustainable Development Goals as a whole? If we don't get this summit going, what situation are we going to be in?
I think it's insane that we live in a time where our children breathing in clean air and our children getting to school safely is not a fundamental, basic human right. And their rights continuously are being violated, and something really needs to change, and we're simply not doing enough. And I'd wonder what our, policymakers and international community are saying to their own children. Are they able to look at their children and explain why, their safety and their health is not a priority?
Excellent. One final question, because we're going to completely get thrown off the stage in a minute, I know, which is just to bring it back to your own, to your grandparents. What would your grandparents think of all of this? Yeah. Presumably, it's a question that you think of now and again. Yeah. What would they be saying? What would they want? What would they want to see?
Yeah. I mean, I think. Well, I obviously can only just speak personally from all the lessons that they imparted, and I think. What sticks out the most for me is what they've always taught me about having the power within you to effect change in the lives of those who are less fortunate than we are. And that should be regardless of the challenges that we face and our own sacrifices.
Zoleka Mandela, thank you very much, and thank you to the SDG Action Zone. It's been great. Thank you.
Thank you.
Hello again. I am so excited to introduce our next lightning talk, and I'll just tell you a little bit about it before we bring our speaker up. Uganda hosts over 1.4 million refugees, but health human resource gaps in rural public health facilities and emergency settings increase out-of-pocket healthcare spending as refugees resort to private health facilities. Innovative solutions to address these health human resource gaps in refugee communities for UHC is what our next speaker is going to talk to us a little bit about, and I bet he actually has an innovative solution to share. So please help me welcome the Executive Director of the youth-led organization Rural Aid Foundation and co-president of Global Health Corps Uganda chapter, Frank Ategeka. Frank Ategeka. Even you people in the back, I want to hear some cheering for Frank. Thank you.
Thank you.
Go on. Have a great time.
Hello. Hello. My name is Frank Ategeka, and I'm the Executive Director and a co-president, Rural Aid Foundation in Uganda. I'm also a co-president, Global Health Corps chapter in Uganda. I was born as the biggest number of refugees in Africa. These refugees come from different countries across Africa, and we have around 1.4 million refugees. And when you look at the World Health Organization recommendation of the human resource personnel, health workers to the population, Uganda has actually 0.4 compared to 2.5 recommendation by the World Health Organization. And this has increased out-of-pocket expenditure for healthcare services for the refugees and the host communities in the country. Now, as Rural Aid Foundation, of course, we needed to look further than this and find a solution to this. And our solution is what we call the Send a Health Fellow to a rural health facility. And this is how the model works. What we do identify gaps and partner. So we look out to rural communities or refugee settlements which have the highest number of refugees and health care gaps in terms of human resource. Then we recruit health workers, and when we recruit these health workers, we train them on issues of universal health coverage, sexual reproductive health, LGBTI rights, and then after that, we deploy them to these health facilities. And after we've deployed them, we do, each of the fellows is meant to treat or reach out to refugees at a health facility where they are actually placed. And after this, each of the fellows is also meant to keep track of the number of refugees they have treated or provided healthcare services per month. And then after this, we do a transition. After someone has been on the fellowship for 1 year, they transit into an alumni community, which is an arm to keep advocacy for refugee health rights. And finally, we do, the alumni community keeps advocating for the rights of refugees, and one of the examples is just down right here in the picture. Then what is the impact of our work? You see that when we get one health fellow and we post them to a refugee community, each of the fellows can reach out to 83 patients per month. And in 1 year, you can have 1,000 patients or refugees treated annually by one health fellow. And when you get into 1 year, and for example, if you have 20 fellows posted for 1 year, 20 fellows would be able to reach out to 20,000 refugees with health care at no cost. Then during the fellowship year, each of the fellows is also meant to do a community outreach activity on a key health gap or identified challenge at the health facility where they are placed. And for each of the fellows, it has a target of reaching out to 100 people. For example, if you are placed at a health facility where there is a high prevalence of HIV, then you have to organize a community event and sensitize the community on HIV prevention. So each of the fellows can reach out to 100 people for a year, and during this one event. And when you have 20 fellows, then this means you have 2,000 extra people reached on top of the 20,000. Then in terms of the cost, we are speaking about universal health coverage. How do we aggregate this to in terms of money or expenditure for health? Each of the fellows, the cost of recruitment for each of the fellows is $270 for each of the fellows per month. And when we have 20 fellows per year, this comes to $64,800 for a year. And this means that each, the health cost per patient for each, for the health care cost per patient per year is only $3.24. So you see, you have a small amount of money, but reaching out to a very big community. Maybe one more thing that I would love to provide to this session is that we are calling upon donors, states, and policymakers to prioritize refugee health care needs for us to be able to achieve universal health coverage. And because young people, usually quite often, young people have limited access to such services or to funding. Even when they have the best innovative ideas like this, they may never go out to the global community to have them access funding. Maybe one other thing I would want you to share with you is you can be able to reach us through that website, and also you can drop us an email at info@ruraiduganda.org. And then on top of that, I also have a few other documentation of the work that we've been able to do. And it has also an agreement that we've done with Om Prakash. We are actually running an online fundraising campaign for this project in partnership with Om Prakash, and it can be accessed via our website. When you go to our website, and then you can click on our donate page. It will directly take you to that page, and then we shall be humbled to receive your contribution. Thank you so much, and as I complete, I just call up everyone to unite our hands. Let's prioritize universal health coverage for the most vulnerable rural communities and refugees. Thank you so much.